So this is a referral letter to Dr. Grantley Cross. Dr. Grantley Cross, consultant endocrinologist, City Hospital, Suite 32, 55 Main Road, Newtown. Right. So number one, this left margin you are not maintaining. It's leaving this much space here. See, leave the first line, no problem. Okay, this much space you are leaving. This much space you are leaving. You have to start from here. See, this is okay a little bit, but this is went inside again. This is still went for there. Why this much space you are leaving every time? Okay, don't leave the space like this. Here too much. This also should start from here only. Why are you leaving till here? So every paragraph you are pulling inside. Why? No need. No need to this much. Okay, see. This is even more than that. So maintain the left margin and the paragraphs. So every line should start from here. First line or any line. Every line should start from here. So Mr. Collister, like this. It should start like this. Mr. Collister. So you have left so much space. See? Complete word will come here. So start from here. That's better. Okay. So fine. 24 February 2018. Dear Dr. Cross, after this leave one line. So everywhere you left, then why here you did not leave? So here leave one line. Regarding Mr. Brett Collister, date of birth 21 December 1973, right? Mr. Collister, comma, no space before comma. Space should be after comma, not before comma. Okay, it should be like this, Mr. Collister, comma, who. Like this you have to write. But what you have done is, you have placed a space before comma. The space is unnecessary. Okay. Mr. Collister, who presented with 7 weeks history. No, not 7 weeks history. With a 7-week history. With a 7-week history. Like that you have to write. 7 weeks history is wrong. A history of 7 weeks. So a 7 week should be written like this. A 7-week history. Suggestive of diabetes mellitus type 2. Okay. Mr. Collister. Okay, type 2. Comma. Put a comma here. Mr. Collister, who presented with suggestive of diabetes mellitus type 2. Type 2 diabetes mellitus, comma, is being referred for assessment and management plan. Is being referred for assessment. Further assessment, you can say. Okay, because this is already signs and symptoms. So further assessment and management plan or a definitive diagnosis maybe. Okay, results indicate this one. So preliminary diagnosis. Endocrinologist for further assessment or a definitive diagnosis and management plan. Change, na? For a definitive diagnosis or further assessment. Don't use the same words which are there here, assessment and management plan, as it is you are writing. Why? further examination or further evaluation or further assessment. Change the words, no? Or definitive diagnosis. And appropriate management. And appropriate management. So like that you can say, no? A definitive diagnosis and okay is being referred for a definitive diagnosis and appropriate management. So Mr. Collister came to see me on. Came to see me. He did not come to see you. He did not come to see you. He came to be treated. So this to see me, no, this is not right. He is not coming to see you. He is not your friend or a relative. He is not coming to see you. He is coming for treatment. You have to understand the difference between seeing you and okay, come for treatment. There is a lot of difference. Okay, he will not come to see you. Okay, so Mr. Collister, on 4/2/2018. So you are a doctor. You have to use your words very cleverly. So this on 4 February, write down. Don't write to. On 4 February. So 2018, no need because already you have written here 2018. February you can write, but 2018 no need. And 4 February, comma, okay. Presented, you can say, or visited, you can say, okay. On 4 February, Mr. Collister. Okay, presented with the complaints of, you can say, already you have used the word history. You have already used the word history. And why are you using again with the history of? So you already wrote here with the history of. See, with is here. History is here, of is here. So with the history of. Why are you writing again the same thing? Avoid it. So on 4 February, Mr. Collister presented with the complaints of tiredness, sore eyes, and dizziness. Finished. Feeling tired. Why feeling tired? You can use one word, tiredness. Mr. Collister presented with the complaints of. Okay, tiredness, comma, sore eyes, and dizziness. Full stop. Yeah. So after 20 days, he again had similar symptoms, but now along with reduced vision. In addition to the already existing symptoms, reduced vision was reported after 20 days. During the next visit, after 20 days, during the next visit, after 20 days, comma, in addition to the already existing symptoms, okay, comma, reduced vision has been reported. Okay. So during the next visit after 20 days, in addition to the already existing symptoms, reduced vision has been reported. So like the passive voice, on checking the vitals. So on examination, you can say, on examination, his BP and HR were normal, were unremarkable, you can say. His BP, the BP, you just say the BP, no? BP and HR were unremarkable. Why to say his every time? He, avoid this, his, he. Too many times you are writing these words. Avoid repetition. Okay. So, were not unremarkable and there was no abnormality. Normal means no abnormality. Same thing. Now, why are you repeating? Okay. And there was no abnormality detected in his lungs. Okay. So, yeah, fine. He is overweight, but he had loss of weight over a period. But he had loss of weight, but loss of weight over a period of 20 days was mentioned. Weight loss, but he is overweight. He was overweight. He was overweight. Okay. But okay, so now it is reduced, no? Weight loss. How much weight loss that you did not mention? Over a period of 20 days. This already mentioned over a period of 20 days here. Here, 20 days. Okay. Weight loss of dash kgs has been noticed. Okay. 4. This is 4 February, 24 February. 26, 17, 26, 11. 4 February, 24 February. Okay. Vision. Weight 89 kg, BMI 28.4, overweight. Where is the 20 weight loss? BMI 93 kg, 89 kg, 4 kgs. Weight loss of 4 kgs. Still overweight. In spite of weight loss, okay, weight loss is there, but still he is overweight. So you can say like that. In spite, despite 4 kg weight loss, despite or in spite of, despite the loss of 4 kgs in 20 days, the problem of overweight still persists. Okay. So like that, despite the loss of 4 kgs in 20 days, the problem of overweight still persists. Okay. So you can change this style. So for 20 days, 4 kgs was lost. Okay. Weight loss of 4 kg over a period of 20 days has been reported, but in spite of that, still he is overweight. So how you want to write? There are 100 ways of writing. You can write in any way you want. Then you can use despite, you can use in spite of, you can use however, you can use but, yet, since, although, He lost a weight of 4 kg, even though. Okay. So you can use all these things. A period of 20 days is pointed out in his BMI, which was 29 points, and it was 20. This is too much. You are pulling too much. See how much simply I have said here. Okay. Despite the loss of 4 kgs in 20 days, the problem of overweight still persists. So he lost 4 kg, but still the problem is there. That is what he's telling. So that is the one thing which you have to tell. This is expanded. Okay. He is overweight, but he had loss of weight over a period of 20 days, as pointed out in his BMI, which was 29.7 on 4/2/2018 and a 28.4 on 24. All these things, too much. Okay. Blood investigation done on him. Why on him? Blood investigations which were ordered revealed. Blood investigations were ordered. So blood investigations which were ordered comma, blood investigations comma, which were ordered comma, showed high random glucose, fasting glucose, high random glucose, fasting glucose also high, HbA1c and HDL, okay, ratio. That's it. Blood investigations which were ordered revealed high random, okay, fine. Based on the above mentioned circumstance, based on the above blood test results, Mr. Collister is diagnosed to have diabetes. Provisionally diagnosed. Provisionally, not sure, no? Provisionally. So you're asking him to diagnose. Then why are you saying diagnosed? Okay, you cannot diagnose him. You're asked, then why are you referring to the endocrinologist? You're referring to the endocrinologist for assessment. Okay, because results indicate means suggest. Then how you are saying diagnosed? Preliminary diagnosis, you can say. Provisional diagnosis, provisionally diagnosed with. You can say provisionally means preliminary diagnosis. Provisionally diagnosed with diabetes mellitus. No need to have with, diagnosed with diabetes mellitus type 2. Herewith referring Mr. Collister for further assessment and plan of management. So here you can say, considering the above circumstance, consider all the above mentioned, based on the aforementioned circumstances. Okay, you can say like this. Based on the, change the previous sentence there, based on, remove, based on the aforementioned circumstances, comma, based on the aforementioned circumstances, further assessment. Assessment, again you are writing. Plan of management, again you are writing. Why you are using the same things in the introduction and here? Change, no? Based on the aforementioned circumstances, definitive diagnosis we used. Further evaluation, you can say. Further evaluation and further evaluation and management plan. Management plan would be profoundly beneficial for Mr. Collister. Okay. So like that you can say. And continuation, in case any additional information is required, please do not. Yeah, in case any additional information is required, please do not hesitate to contact. That's already you have written. So no need to write that because you have already written that. Yeah. So like this you can write. Then please do not hesitate. Require full stop. In case, comma here. In case any additional information is required, please do not hesitate to contact me. Very good. Yours sincerely, comma, general practitioner. Right, right. And what about the remaining parts of the address? Anything is there? Okay. In your general practice, so general practitioner. Yeah. No other address is given. Yeah, fine. That's wonderful. Okay, you have to work out, and your handwriting is very excellent, no doubt. But it's not very legible. Write neatly. Take a sharp pencil point so that everything. It's thick and difficult to read. And okay, write very clearly. Handwriting is good, no doubt. But clarity, thickness. Avoid this thickness. Write sharp. Okay, neatly. This is confusing little. So see, this is very nice here, endocrinologist, but consultant is thick, like that. Be careful. And after every 4 or 5 lines, put this pencil in the sharpener and just roll one round enough. So see here how thick lines like this. It's not fine. It's not fine. And so this is blurred. The picture is not very clear. Okay, picture is not very clear. So write neat picture. That is always better. Take a neat picture so that I can see. See, this is a little bit neater picture. This is blurred. You did not even wait to fix the lens. Okay, so relax a little. Don't hurry to take the picture. Just let it set properly. See this picture and see this picture. Huh? It's difficult for me to get an idea. Okay, and don't leave space in the first line, this much space. Okay, right. So now here we are. Yes, I'm giving you a chance to unmute. Yeah, unmute, Reena.
Yes, sir.
Yeah, how was the feedback? How did you find it? Is it important? Did you find some difference?
Yes, sir. Definitely. I didn't know that I should start from the beginning of the line, actually.
Yeah, this is the beginning of the line. Nah? This is line. You have to write on the lines. Nah? Why is this
Okay,
line there?
I thought for each paragraph, starting line should go in, and nowadays new have
Yes,
to
of
start
course.
from the beginning.
Yeah. If you want, you can see any official letter. Okay, we don't know, but we don't know doesn't help us. The word we don't know is not going to help us. So we have to know. See, for example, if we are falling, suppose there is a pit in the road, on the road, and if we don't see some dirt is there, so you have to see. You cannot say, I don't know that there is dirty, pit or something. Okay, so that's the thing. There is no excuse, right? There is no
Yes, sir.
excuse. See, you are walking on the road. I don't know that they have dug a pit. Yesterday it was nice. Today it is somebody dug. It's not my mistake. See, I was just walking like every day. I did not notice. Okay, you can say I did not notice, but you cannot say I don't know. You have to be very careful. That's all. There is no excuse for that. So let me say medicine, case notes. Any case notes you see. Okay. So for example, Annie Hall. Okay. So you can take any case notes. See a writing task for doctor, suppose. So you take any writing task. Okay. A medicine. So take any writing task. Now you can see here how it is written. Can you see?
Yes, sir.
So starting from the first dot only. Correct?
Yes, sir.
So follow that one. Okay. So no need to leave one line. You're already leaving one line. Actually, the thing is, if you don't, this is old form. If you don't leave one line, then you have to push it inside. This is indentation. Because you don't leave the line, but you are already leaving the line. Nah? This shows that it is a new paragraph. This leaving a line shows that it is a new paragraph. So no need to leave indentation again. You understand?
Okay, sir. Yes, sir.
Indentation is the modern method. Indentation is the old traditional method. And leaving a line before the paragraph is the modern method. Okay.
Yes, sir.
So if you don't leave the line here in between two paragraphs, then you have to do indentation. But that is outdated system. So you can do modern method. Okay.
Okay, sir.
Okay, fine. 1 second. So that's very clear. So every day you have to submit a letter. Okay. Right.
Sure, sir.
Every day you have to submit a letter, and be careful, avoid he, she. This is the problem with you. You are using too many times he, she. And he is overweight, but he had a loss of weight. Weight loss was reported, weight was noticed. Okay.
Okay. Yes,
like that. Passive voice you use, and he, personal pronouns you avoid. Okay.
Okay.
And clarity, present clarity, and everything. Okay. Did you get benefit from the feedback?
Yes, sir.
What are the things that you learned today? Tell me.
I should start from the starting of the line.
Okay.
And I have to use passive voice in most of the case.
Yeah.
And I should not repeat the same words which is given in the case note.
Yeah. Show that you know English. Don't show that you have copied the words from the case notes.
Yes, sir.
And most importantly, you should not prolong the story. Okay, this is the prolongation of the story. See how much you are pulling like a bubble gum. He is overweight, but he had loss of weight over a period of 20 days, as pointed out in his BMI, which was 29.7, and now it is 28. Okay, see 20. So all this is too much, right?
Okay, yes, sir.
Don't pull that much. Just simple. Okay. Despite the loss of 4 kgs over a period of 20 days. Okay.
Yes, sir.
Okay. You can just say like that. So you can say like this: over a period of 20 days, the problem of overweight still persists. So simple, no? Correct or not?
Yes, sir. Correct.
So simply, write simple. Don't need to do all these things. Okay, fine.
Yes, sir.
Okay. You can call me for a minute.
Okay.
Okay. You call me on the phone for a minute.